as we age, the teeth actually become very difficult to remove, harder to remove. There's more risks involved. There's more complications that can arise in the recovery period or in the surgery itself.
Hey there, I'm Ashley, mom of four and creator of Reps and Redemption. Join me as I share my passion for health education, explore all things fitness and nutrition, plus share a little faith-filled homemaking along the way. If you're a mom ready to build strength and live a life of epic redemption, this podcast is for you. Let's get after it.
Why don't you introduce us and tell us a little bit about what you do and what you think we should talk about today?
Well, hi everyone, and thank you, Ashley. I'm really excited to be here. My name is Jaclyn. I am a board certified oral and maxillofacial surgeon practicing in the Cleveland, Ohio area. Practice a full scope of oral maxillofacial surgery. I love to talk about my specialty, increase the visibility of it because people maybe have heard about an oral surgeon, but a lot of people still don't know exactly what we do. And then I also just love to be there to answer questions to anyone who may be interested in pursuing a career in oral surgery or in surgery or medicine, surgery in general, and what that's all about.
That is really interesting. I have never had a surgeon on the show. You are the first, so welcome. Thank you so much for being here. What kind of interest does that take? Like, what made you want to get into oral surgery?
Well, sure. That's a really great question, actually, because it was kind of evolution for me. So, oral maxillofacial surgery is best described as we're experts in the face, mouth, and jaw, and we are a combination between medicine and dentistry. So, I initially set out after undergraduate. I attended dental school at Boston University with an open mind, but with
Hmm.
intentions to graduate with a dental degree and do just general dentistry. And then about 3 years in, I kind of was introduced to oral maxillofacial surgery, and I really didn't know much about it. Over the course of the next year or so, I was really encouraged to pursue it, and I really kind of just fell in love with it. So I did decide to pursue it after graduation. Oral maxillofacial surgery, of course, and I say of course because I entered dental school saying 4 years, I'm four and done, which is like not a small amount of time. But
Right.
I was like, well, I'm just going to do four and done, and then I'm going to move on. Well, oral surgery is the specialty that is the longest. So it's 4 to 6 years, and I decided to go all in. I did the 6 year program. It's called an integrated residency program because it integrates medical school into your training. So
Wow.
I went to dental school, then I went to medical school and completed residency to get to where I am. But like I said, we're the experts in the face, mouth, and jaw. So we do surgery, obviously inside the mouth, wisdom tooth surgery, dental implant surgery, any kind of oral biopsies, oral cancers. I don't specialize in cancer, but do some benign oral mucosal stuff. We do facial trauma. We also do facial jaw reconstruction or what is called orthognathic surgery. We do TMJ surgery. We also do facial cosmetics like Botox and
Mm.
injectables and even facial surgery. So it really spans a wide range of procedures, which is what I love about it. And then it also, like I said in the beginning, it's very heavily based in medicine. So we really have to have a strong medical background, which
Mm.
is where the medical school piece comes in, because as oral surgeons, it's very unique. We actually do administer our own anesthesia in our private practice or office settings. Most of us do that through an IV, similar to if you went to a surgery center. But you can imagine that takes a lot of extra training, extra background in not only anesthesia, but again, in medical management of patients. So that's where the medical school training really is important for what we
Mm.
do.
And have you found that you have a favorite type of surgery to do? Is there something that you really enjoy doing, or are some of these things that, I mean, you obviously enjoy parts of it, right? But are there things that about the oral surgery part that you enjoy doing when you know you're going to maybe make somebody happy or like something's going to be, quote, fixed? Is there something in particular that, lights you up?
Yeah, yeah, absolutely. I mean, sure. So probably some of my favorite procedures, trauma. I've always loved trauma. I did my residency in Detroit. So downtown Detroit, we had a lot of trauma. I did my residency in a level one trauma center, probably the most high volume level trauma center in Detroit. So that was just kind of like my bread and butter. And so I still love it. It's always fun. It's kind of like a puzzle that you get to put back together.
Mm-hmm.
It's very routine. One of our bread and butters is just wisdom tooth surgery. And believe it or not, like that, it can be a challenge every single day, and every single case it can be different. So I really enjoy that challenge on a daily basis. I also, like I mentioned, enjoy the anesthesia piece of it. It really requires us to be very up to date on medicine and anesthesia. And so it also allows us to collaborate a lot with medical colleagues, which is one of my favorite parts of really of my specialty, but like medicine in general, is just the collaboration that you have between specialties, between colleagues, and to kind of like share ideas and thoughts and different experiences. And then finally, I also like orthognathic surgery. I did a fellowship in that out of residency, and that's complex jaw reconstruction when patients are born with congenitally disharmonious jaws. I mean, the biggest issue is function, of course, but aesthetics plays a big role in it as well. So that is very life-changing for patients. But at the end of the day, I get joy every single day because the smallest procedure to the major ones, it doesn't matter what you're doing. You really are helping people, and that really is a great feeling to be able to be a part of.
That's amazing. I didn't know that about having the anesthesia part of oral surgery, but it would make sense because I mean, I think personally anything with mouth, teeth is like, super like painful in my opinion, and you would need that component. And the fact that you get to work and collaborate with other medical colleagues is amazing. So what is it about wisdom teeth that makes it so challenging? Like, I still have all of mine, but for example, my dad literally just had oral surgery 2 days ago, and he had one in the back that was like totally flipped on its side, like underneath. Like, I don't even know how. I need to ask him. I'm sure he told me, but I'm newborn baby stage, still sleep deprived, so I don't remember. But he said it was turned to the side. So how does something like that happen, and what makes the wisdom tooth part so challenging?
Well, that's actually very common. And wisdom teeth, the reason why they need to come out is mainly because they don't fit in many people's mouths. I mean, there are certain situations here and there, but for the majority of patients out there, they don't fit in their mouth. And so as we grow, that's how the teeth grow. They grow on their side a lot of the times. And so that's why they become a problem. I mean, some of the challenge does lie in the fact that for many years there was kind of like the thought process that it was, if they're not bothering you, then just leave them alone.
Mhm.
In the last 10 years, at least in my era of training, that definitely has pretty much completely changed. We know that as we age, the teeth actually become very difficult to remove, harder to remove. There's more risks involved. There's more complications that can arise in the recovery period or in the surgery itself. And the sweet spot is between 15 and 25 years old, where both the patient and the teeth are still in stages of development. That makes it them easier to get out. That makes the surgery easier on the patient and the recovery as well. But I would say, to answer your question directly, the different orientations that the teeth are in, the different structures that they're adjacent to that you have to work around, protect. Those are like the day in and day out challenges. And there's different ways to get teeth out. We have all kinds of different like approaches and different instruments that help us do that. So it's really fun to do that. It's kind of like a puzzle, kind of like every day, because I could have 4 sets of wisdom teeth every day in a day, and I could have each one could be significantly different in the way I actually remove the teeth, totally depending on the way that they are
Mhm.
impacted, basically.
Right.
So
Well, you just totally blew my mind. Between like 18 and 25 is the sweet spot. And with age, it's harder to remove teeth. And we, on this show, we talk a lot about, preserving strength and, our bones as we age. We lose muscle, we lose strength in our in our bones and things. And I would think that it would be easier, but that's really fascinating that it's actually more difficult. While you were talking, I was like, I'm like feeling my wisdom teeth with my tongue. I'm like, I don't know, these babies need to come out. Like I have been like that. I haven't even really thought of it. I've heard that before that most people they can't fit into their mouth. So what would you say? One of my big questions is, oral care. We talk a lot about health on this show, as you know, and what is there, like, is there some sort of regimen that we could do either daily or weekly to aid in the longevity of our teeth? Like, is there something in that realm that you would suggest? Like, everyone knows about brushing and flossing. I like still need to get used to flossing. I know that sounds absolutely horrible, but what are your thoughts on that?
I mean, I was gonna say it's pretty simple. I mean,
Right.
it hasn't really changed throughout the years. I mean, brushing and flossing is just key, really. I mean, I joke all the time. I mean, I brush my teeth like 3 times a day, minimum,
Hmm.
every single day. I brush pretty much after every meal because I'm just that, retentive about it. Flossing, yeah, it's not fun, but I do it at least once a day. And just like anything in overall health, drinking an appropriate amount of water, obviously, staying away from, really sugary drinks. I mean, and that's really the biggest thing about brushing your teeth. And so we're talking, I don't know when this is going to air, but we're talking right now. It was like Halloween earlier this week. So, all the kids with the candy and all that things. And, I just tell people,
Yeah.
I'm like, I have the biggest sweet tooth in the world. You can still enjoy those things. You just have to brush your teeth. And that's really where the problem lies, is that kids eat all this junk and eat, or not kids, anybody, eats very sugary foods, and then it sits on their teeth for long periods of time, and that's where the issues arise. So, you don't have to cut it out completely unless you just don't brush your teeth. And I would say, yeah, you should try and cut that out, although that's going to
Right.
cause some issues. But and then a good balanced diet of like fruits, vegetables, proteins, lean meats and things like that. So, I mean, it's just kind of like normal overall like nutrition
Mm.
that's smart for not only your body, but it's going to be good for your mouth as well. And then the other thing I would say is, because I see this a lot, is that, many people, I mentioned that we do, one of the procedures that a lot of oral surgeons do pretty regularly is placement of dental implants to replace missing teeth. And many people still do consider that very much a cosmetic procedure,
Mm.
um, which in some ways it is, but it's kind of like the jaw surgery. It's kind of like a trauma surgery. Like, in a way, everything is cosmetic because we're restoring form and function.
Right.
And the same thing is true for dental implants. And, I would encourage people, like, once you start losing a tooth, like, it's kind of can be a slippery slope. You want to replace that space because that's going to keep all your other teeth in line. That's actually going to make cleaning your mouth easier. It's going to retain your bone structure, all those things. And if you begin to lose more and more teeth, then it actually becomes harder to restore um, implants like that and the
Mm.
form and the function like that. So to try to get to people to like look at it as like, yes, it's not just, an aesthetic procedure, but invest in your overall health. I mean,
Hmm.
I guess to me that's not a stretch, but to a lot of people that can be a stretch to think like it's just I lost a tooth. How is like replacing it with a dental implant really like helping my entire systemic health? But
Right.
I think it's
No,
important.
I do too. Well, and you just said it, like, honestly, Halloween is like, I don't know. I want to say every mom's, but it's like my worst nightmare because it's like I want them to enjoy it and have it and like be done with it. But then like if I know it's there and I have a sweet tooth, I don't really want to eat that stuff. But if it's around, like I don't really have a problem with like any other sweets. But when I see like a Kit Kat, one of those like mini Kit Kats, I'm like, oh my gosh. And I thought that I should brush my teeth like right after because we're getting into this in my family, just wanting to take better care of our oral health. It's pretty simple, but when you look back to, okay, before there was dentistry and oral surgery, what did people do? Well, there wasn't all this sugary crap before that. Like it was fine. You didn't have to really probably worry. Most of your food was pretty much whole food from the earth, and you didn't have to worry about it. Now, do you have any thoughts on, and then I want to ask you like how you fit in like all your exercise and fitness because I know you're really into that. Do you have any thoughts on cavity reversal? Because I'm really curious. Like, let's say somebody has a cavity. Have you ever heard of that? Is there a way that you think, because there's been a few experiences I've had with it where I've seen one coming on and I took out oats and sugar. It was pretty much gone and then it was gone. And I don't know if, I mean, for me, it's like it could have just been a toothache, what I thought was a cavity. I don't know if you've experienced this before or if you just kind of like run into, okay, you know what, this is too many cavities. We've got to do something here. What are your thoughts on that?
So that's getting more into general dentistry, which I don't
Hmm.
really do. I would have to defer to a dentist actually to answer that in more depth or
Hmm.
detail. I mean, the concepts just make sense, I guess. If you are having the beginning of a cavity, that the more sugary foods is going to kind of attract that, and that's what leads the cavity to grow. That's why they put like fluoride on your teeth, and vitamins D and calcium can
Mm.
strengthen your bone and enamel to protect the teeth. So I do believe that that probably is very possible. That's not really in my wheelhouse on a day-to-day basis.
Hmm. You
Um,
see too many
so
wisdom teeth.
so as oral surgeons, we do not practice dentistry at all.
Hmm.
We are just limited to oral and maxillofacial surgery, like all the procedures that discussed. And so really the only thing we do with teeth is either pull them or replace them with implants. We
Mm.
don't do any of the dental work. I mean, we talk about oral hygiene care, like yes, I take care of my own teeth, but we don't do cleanings, we don't do fillings, we don't do any of that. That's why, the really preventative stuff done
That's
somewhere else,
that's done somewhere
that's
else. Yeah.
by the time we get them, it's be unfortunately a lot of times it's like beyond that
Right, right. They have
repair.
to come to
But
you.
in that way as well, that's another reason why wisdom teeth become important to remove, because the way that they're impacted can cause irreversible decay on the adjacent teeth.
Hmm.
And so, especially the ones that are on their side or tilted forward in the mouth, because that's kind of leaning up against that tooth in front of it. And so it makes it difficult to floss back there or to brush back there,
Hmm.
and that can cause problems as well. And then while we were talking, that like brought up another thing in my mind too, as in terms of like losing teeth, right? I talked about that I do one of my favorite procedures is trauma surgery and doing trauma surgery. And we actually, when people break their jaw, either their upper or their lower jaw, we actually use the teeth as a point of stability when we
Wow.
are fixing the jaws. And so it actually is a lot easier to fix a broken jaw on a patient who is completely or near completely dentate, meaning that they have most or all of their teeth, versus someone who has a lot of missing teeth. That
Hmm.
really makes it more challenging because we don't have that point of stability to kind of like build off of, if that makes sense.
No, that does make sense. That's super interesting. So if teeth are missing, it's harder to put the jaw in like the proper place. Is that what you're saying? Like line it up correctly and then
Because we try, when the jaw is broken, and it depends on how severe it is and how many places it's broken, because especially the lower jaw usually gets broken in multiple places. We have to have a point of stability where we can build off of, and so we use the teeth as that. We kind of That's where the term wiring your jaw shut comes into play. We essentially wire the teeth together to create that point of stability. And as you can imagine, when there's like a full arch, of teeth on the top and the bottom, that's easy. That's easy to put together. But if there's like only a couple teeth on each side, it becomes a lot more difficult and a
hmm.
lot less predictable. So yeah.
How many surgeries do you think you do a week? Do you have a set number or does it vary?
It definitely varies by season, and we always say wisdom tooth season is kind of like in the summer during the holidays, because again, that sweet spot is like the teenage and college years, so that's when most kids are getting it done, and so that's basically works around school holidays, right? And
Right.
school breaks. Same thing with jaw surgery, orthodontic surgery. Again, that those mostly are in teenagers and college age students. So surgeries tend to be planned around the summer and holiday break, and kind of varies by the season. We've always said like September and February are kind of like our seasons,
Mm.
I guess, because people, it's like just after the summer or just after the new year kind of like type thing. And we also do a combination. A lot of us do a combination of both office surgeries and hospital surgeries, which is what I do. So I do office surgeries every day. It varies between a handful, sometimes, less, sometimes double that, like 5 to 10 um, office surgeries. And then it just kind of, again, depends on the season, depends on the schedule. Like I personally go to the OR maybe like on average one time a week, or, um, and I usually limit that to like one day.
Hmm.
So, I mean, but most of us, are doing like, I mean, an average oral surgeon could do anywhere between 20 and 40 surgeries a week.
Oh my goodness. That is okay. So that leads me, that's a perfect lead into my next question for you. How do you, take care of your own health and physical fitness and your energy to be able to do this? Because this is like super serious, right?
No, no, I'm glad you bring that point up because I think it's very overlooked. It was when I was in residency, it's less now, but absolutely. What people don't really tell you, oral surgery in general, it's a very like physically challenging job.
Mm,
We're on our feet. So surgeons, we don't sit. I mean, some of my surgeon ophthalmologists, the eye doctors, like that's very delicate surgery, and most of them
mhm.
do sit when they're doing surgery. But for the majority of surgical subspecialties, we are standing. We operate standing up in the operating room. So,
Wow.
like, um, you know, 5, 6 hour surgeries or more, we are on our feet that entire time. And even my office surgeries as well, we stand for those surgeries. So that's like very challenging. And, I joke all the time, like, you know, my back is like awful, just the way that we contort our bodies
Hmm.
to do what we have to do. So yes, people overlook it, but oral surgery is a very physically challenging job. So I think that it's very important to maintain a healthy fitness routine, wellness routine. So I encourage all people to do that who are thinking about surgery. I personally have always been very active. I was an athlete growing up in high school. I played volleyball and basketball, softball, like year round. I was always active, and I still am very active. And um, for me, it's quite easy. I am a morning person, a morning workout person. That's when I do my workout. So I get up um, usually between 4:30 and 5 every morning and get my fitness routine done, and
You
it
get
kind
it
of gets me
in.
going. I get
Yeah.
it in. I get it in. And that definitely has changed throughout my career. Probably about 10 years ago, I was a evening workout person. I would work all day and then go straight from work to the gym, do my work routine there. So it's really, I mean, there's no perfect way. It's for
Right.
what's perfect for you. But I just think that it's so important to make that a part of your routine. And since any surgeon is going to be type A to some degree,
Right.
we're very big on like schedules and like checking boxes out. So, if anybody is struggling with that, I would just recommend, you just got to schedule in your day, just like anything else, just like that meeting or that consult or whatever you have to do. You just schedule fitness into your day.
Yeah, and I think it's definitely important too because it does give you more energy and it sounds like I mean we all need more energy, right? I don't think there's a person who doesn't. Well, maybe my 6-year-old. I don't know if she needs more energy. But outside of her, yeah, I think too and like you were mentioning when it comes to even just, oral care and for example of just eating healthier and eating cleaner. What is a day what like run through like really quickly, like one of your favorite meals, like whether it's breakfast, lunch, or dinner, like what do you kind of plan? Do you meal prep or does that help you or do you kind of plan, as you go or weekly? What does that look like?
Yeah, I'm a loose meal prepper, I would say. Like I have gone through stages of it, like where I've been like really into it and done. So I meal prep like one day at a time, which I don't know if that's really meal prepping, but
Hey, I think it
um
counts. If it helps you the next day, it counts.
I mean, my biggest thing, and I've worked with a lot of people in a lot of places, like the most important thing for me is to bring my lunch to work every day.
Mm,
I very rarely like order out for lunch or eat out for lunch, and I think that's very important. So And I mean, my meal is very simple. It's like some kind of vegetable. I like to just saute mine on the stovetop with just some olive oil, and then some type of protein, either like a fish or um, I do a lot of um, tofu and fish and like chicken, that kind of thing. I
Hmm.
mean, that's my go-to
Right.
basically. Um, and I'll always have usually some carrots, or I really like those um, mini peppers. They're just
Oh,
easy.
we
I
love
like the way
those. Yeah.
I like the way they taste, and they're easy to transport. And then I really am a fan of Greek yogurt. I think that's a great source of protein. I really got into that about 6, 7 years ago, and I probably eat that like every single day. Um, so yeah, I mean, I just make it simple. It's like the same thing every day. I always joke. I'm like, yeah, I mean, I really do eat the same thing pretty much every day for lunch. But I just think that that's so important. Um, because I'm not gonna, I mean, sometimes the way the job is, you don't always get a lunch break.
Right.
If you're busy or you have emergency patients, or things here and there, like obviously that happens. But for the most part, like I always make time to at least get something in, because I need that refueling for myself to get through the day. But you also don't want something that's very heavy that's going to, weigh you down, because then, I mean, there really is some truth to that, like post food coma. And,
Right.
that can be, obviously detrimental, or um, not good for your afternoon if you have to,
Right.
be on your feet and different things. So I just say keep it simple. I mean, I have friends and I admire them so much. They really get into the meal prepping. I'm like, I wish I could do that. I need to do that. But that's just not where I am right now.
Yeah. I mean, hey, you know what? I always say like whatever works for you in the season that you're in. Like right now we meal prep on Sunday and Monday, or sometimes it's Saturday and Sunday, but it does vary. Like it will do like two or three different proteins, and then we have like the veggies set, and then like I love having something sweet after lunch, especially and it's usually dark chocolate. So I already plan that. Like I already count on it. It's like everything's already ready. And I like what you said though about making it simple, because we can overcomplicate it and think it needs to be this like beautiful Pinterest worthy like thing. And if we like the way it tastes, it is worthy, like at least enjoy it, right?
Well, exactly. You want to have something that you look forward to eating. And I will say that, like, I do look forward to eating my lunch because I know that I made it. I know it's something that, like, I like. So, I mean, and I know that it's like right there too. Like,
Hmm.
every once in a while, when I don't have time, I'll have to like order something out. And it's always, honestly, it's a stress for me, because I'm like, oh, you have to like plan it, you have to order it, then am I gonna have it delivered? Then you have to have someone pick it up. Can I pick it up? Like, it really is like a stress. I'm like, I just don't need that.
Yeah. Well, and right now I'm tracking my food, and like I think to each their own, like if you know what you like to eat, like and there's seasons where I haven't tracked anything. It's just mainly so I get enough protein. And I've realized with, when I track my calories too, because I make sure I hit that and I don't go over it. And then I get my protein in, but I could order a salad, like a beautiful looking salad from somewhere. And it could be like literally all of my calories that I can have in a day. And I'm not saying there's anything wrong with, you know, counting calories or not counting calories, but it's because of the dressing and the extra this and the extra that. And it's like this gigantic portion. And I'm like, oh my gosh, I should have just made this. This is like super stressful because I want to eat whole, I want to eat clean, I want to eat like all these things and still have my chocolate too, and it's just way easier. But I can see how,
Absolutely.
and you said that afternoon slump. I tend to feel like that if I eat and I make bread. I make bread from scratch. So it's like I'm all about making
Oh,
sourdough bread, but like
I was gonna
afternoon
say, are you the
slump.
sourdough people? I mean, the starter loaf or whatever it is.
Oh
I
yeah.
mean, I've
Oh
heard
yeah.
so much about this. I got friends trying this, so major props to you. It is not easy from what I've learned.
No, it's not, but once you get the hang of it, it's super fun and I love making it. But like, yeah, I can't eat it in this like in the after like first thing or in the afternoon. It's something that I might have like later or definitely like pre-workout, to just like get it in, but I don't eat too much of it because I just like giving it away. So that's where I'm at with that. But I want to thank you, Jaclyn, so much for being here with us today. I want everyone to be able to contact you. Let us know your location too, but where can people find you and follow you if they're interested in coming into your office or just reaching out with some questions?
Yeah, absolutely. So you can find me on social media on Instagram. It's Dr. Jackie is my handle, and that you spell out doctor, and Jackie is Jacci. That's probably the platform where I am most active. You can also email me. I can give you my email, but jtomsick at med.wayne.edu. That's also something that I'm on every single day. And I practice in Cleveland, Ohio area, Independence, Ohio, for the clinic for cosmetic and maxillofacial surgery. I have a female partner, so we practice together, which is awesome. So if you're in the Cleveland area, I would love to help you out. Come see me if you have any oral surgery needs or issues.
That is amazing. Thank you so much for being here with us today.
Well, thank you for having me. Like I said, I really appreciate the opportunity to speak about what I do and what I like, and hopefully it can relate to a few people out there.
Thank you, Jaclyn.
Thank you.
If this episode inspired you, will you share with a friend? Remember, this podcast offers health education tips and holistic insights. Please consult healthcare professionals for personalized advice. Until next time, Mama, be bold and live well.